So, what do we do for clavicle fractures? Well, there's non-surgical and surgical treatment options. Typically, the easiest way to describe it is that the worst of the clavicle fractures are the ones that are 100% displaced with at least 2 centimeters of overlap and displacement. Tenting the skin. Open, obviously, they're the worst. Like if you rupture the skin, you have to go in and clean it out and fix it and repair it because often there's more damage. There's damage to the muscles on top, there's damage to the skin, but there's also risk to the vessels underneath, which more likely in penetrating wounds or traumatic car accidents or vehicular trauma, as it were, if we get proper. So, but we're not proper here. We are unscripted. So, when we look at the clavicle, depending on the nature of the injury, if it's minimally displaced, typically we can treat that non-surgically. Sometimes, if it's even displaced a little bit, but not significantly, the soft tissue envelope. The soft tissue envelope, that's everything around here. Now, what's important about fracture healing? Come on, I know you know this, I know you know it, the periosteal sleeve. In kids especially, the clavicle often doesn't fully ossify until 22 sometimes in young males. So when you talk about the collarbone, the soft tissue envelope is important because, no, not cricket. We're not talking about cricket. We're talking about nerve vessel blood supply. What's the most important thing in healing? Blood supply. If you don't have blood supply, you're not going to heal. So that's why smokers have the biggest challenge. The nicotine completely cuts out the oxygen supply. And you can have a bone that would otherwise heal go on to a non-union or at least delayed union. Now, we're not talking about that for these athletes. As far as I'm aware, I don't know anything about their smoking and their recreational habits, but let's assume they're healthy. They have no medical disorders or inflammatory disorders or chronic disease as far as we're aware, and they're not diabetic. They don't have any chronic health problems, cardiovascular, neurologic, or anything like that. So their soft tissue envelope was fully intact. Envelope, 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 tomato, tomato, back. So the soft tissue envelope, let's assume it was intact, and then you break it. I can't break it, it's plastic. Then you have to talk about healing. So, and it also depends. If it's distal and it's minimally displaced, you can treat it without surgery. If it's mid-third clavicle and it's minimally displaced, you can treat it without surgery. If it's proximal third, most of those are treated non-surgically unless there's a complete disruption and elevation that affects your esophagus and your neurovascular structures. Now, the proximal third dislocations, they can be bad if they go posterior, exactly. So if they go back, because then they can hit the vital structures in the back, inside your chest. So typically we don't do much, in terms of mild sprains or dislocations anteriorly. Sometimes there's surgery options for it, but typically significant posterior 100% dislocations from athletic or traumatic vehicular trauma type of disorders, you do have to sometimes repair them.